Penile implants are often offered to men after they've tried and failed more conservative treatments, such as pills or injection therapy. Insurance often does cover penile implant surgery, both private insurance and Medicare. The two most common forms of penile implants are what's called a semi-malleable penile implant or a semi-rigid penile implant, and a three-piece multi-component inflatable penile implant. A malleable implant is placed within the erectile bodies and bends up when you want to have an erection and bends down when you're not being sexually active. It is very easily utilized and is often used for men with poor manual dexterity, in other words, poor usage of their hands. On the contrary, a multi-component inflatable penile implant has a flaccid or non-erect state and an erect state when it's inflated, and it's generally activated through a very simple motion of a pump in the scrotum. The penile implants are sized during the operation after the length of the penile corpora, or the part of the penis that gets filled with blood during erection, is measured completely and fully. The device is operated through a pump in the scrotum, which transfers fluid from a reservoir into the cylinders in the erectile body. When the fluid's in the erectile body cylinders, you have a rigid erection, and when the fluid's in the reservoir, you have a flaccid or soft penis. After one has a penile implant, ejaculation and sensation is the same, if not better, than it was prior to the implant, because now there is rigidity and there's more friction, so sensation is better, and ejaculation is unchanged. The procedure to implant the penile implant is either done through one of two ways, either an incision in the scrotum or an incision above the penis. Through either incision, all parts of the penile implant can be placed through one incision. That includes a reservoir, which goes in the groin region, cylinders, which go in the erectile bodies, and a pump, which goes in the base of the scrotum between the testicles. The recovery for a penile implant can vary. Some men only have discomfort for a week, though for some men they can have discomfort for several weeks. We generally don't like men doing any heavy lifting or exertional activity for about 3 to 4 weeks after the penile implant, and we don't let them utilize the penile implant for 4 to 6 weeks after surgery. Penile implants nowadays are quite durable. On average, they do last about 10 to 15 years. In some cases, it's less time. In some cases, it's more time. The satisfaction rates both for the patient and partner are extremely high and tend to peak after a year of utilization. They tend to reach ranges above 90%. Overall, a penile implant is a low-risk surgery, but it certainly does have some risks associated with it. The one that is of most concern to most patients is infection, but in general, most patients only have a 1 to 2% risk of a serious infectious complication. The other potential risks of a penile implant surgery is bleeding, device malfunction, device erosion, and damage to adjacent organs, which could include the bladder or the urethra or urinary tube.